power of one. Today, we will be discussing the COVID-19 pandemic and the effects of the new Delta variant. The COVID-19 pandemic is far from over, and we still have to protect ourselves. Please continue to wear your mask indoors, even if you are fully vaccinated. Please think of the children in your family, your parents, your loved ones. Education is important, but please check your information and make sure it is accurate. Joining me today is Dr. Erica Harris from Einstein Healthcare Network, and she will help educate us on the Delta variant. Welcome to the show, Dr. Harris. Dr. Harris, what makes the Delta variant so spreadable, and why are experts so worried about it?
Yeah. So the Delta variant has mutated. That means that it's changed in a way that makes it more transmissible. The surface of the virus can attach to our bodies inside more easily, and it's carried in potentially in higher numbers inside of our bodies as well. So it can pass more casually. With the original form of the virus, we could pass it through more prolonged contact. You'd have to be, in direct contact with somebody for a longer time. They'd have to be breathing around you for a longer period of time, potentially in more of an enclosed space. And the thought now is that it takes a lot less time around somebody to have the same kind of spreading ability, and you can get sick a lot sooner after being exposed to somebody. And we're not sure yet if it can actually cause more serious disease. There are some suggestions that it might, but we can't say for sure if it is going to cause more serious disease. Certainly, if it infects a lot more people, we will see a potential burden on hospitals, particularly in areas where there are a lot of unvaccinated people, because that's who this is affecting most, people who have not been vaccinated.
Now, is it spread the same? I know it's a variant of COVID-19, but is it spread the same way through a cough or sneeze?
Correct. Yeah. So it is spread through the same ways. We're learning more about this as days go on. Just like in the beginning of the pandemic, we were very worried about surfaces. If you remember people coming home and kind of disinfecting their groceries, I'm sure there's people who are still doing that. We're finding more and more that's less how it spreads, and it's more spread through sneezing, coughing, and even breathing. And that's one of the concerns that if you're in a room in an enclosed space with people, they don't have to show signs of illness. Like you don't have to see them sneeze or sneeze on you to catch it, that you can just be having a casual conversation with somebody and that you're breathing out virus particles onto somebody. And I can catch them, say from you, if you had an infection, just from talking to you and breathing as we're talking very casually. And so that is how it's transmitted. Certainly if somebody sneezes on you, then that is a good way to catch it. If they cough on you, those are things that we call generating aerosols. You've probably heard that before. In the healthcare environment, we worry about certain procedures that we do, being around people who are ill, who are very ill, who are coughing and sneezing a lot. And that's why we wear special masks when we are taking care of those patients. But in everyday use, the point of wearing masks, even if you don't have symptoms, even if you're not sick, is because you may not know you have an infection. And when you wear the mask, you're blocking the flow of the virus outside of your nose and your mouth and preventing that from potentially infecting somebody else.
Okay. Now, the COVID-19 virus, they did say that you had to be around someone for about 15 minutes or more to be able to contract that virus. Is that the same for the Delta variant?
We're thinking it's less. I have heard that it can be as little as walking past somebody. I don't know if that's actually been proven or not, but certainly it is much better at infecting people. You may have heard of the term R naught. That is a scientist's term for how many people you can infect if you get an infection. And so with the original form of COVID, the thought was that you could infect 2 to 3 people, which is kind of around what you see with the seasonal flu. Colds are a little bit more contagious than that. What we're seeing with the Delta COVID is that you can infect 8 to 9 people for every person who is infected. And that's a lot. That makes it basically as infectious as chickenpox, which is also very infectious. So it can spread so much more easily. It's the term is really the fastest and the fittest. And that's part of why it's so common now. It's actually one of the most common strains that we're seeing. Over 70% of infections in this area now are due to the Delta strain. So it's actually taking over because it's so good at infecting people.
Okay. Now, Delta is one COVID variant. With all the new variants, will the COVID COVID-19 test still work?
So it will. So think of it this way, that the COVID test detects the virus itself, and the virus itself is kind of like who you are, what you look like. The changes that happen to make it the Delta variant, it's kind of like changing your hair. You get a new haircut, you get a new hairstyle, you color your hair. They're kind of superficial changes, but the tests will detect the core of the virus, and so that does not change. So the tests are still effective. No test is perfect. You can still get a false negative test, so you may still have the disease, and the test will not detect it perfectly. We know that. That's one of the just parts of the testing that we have accepted, that we understand to be the case. Sometimes you'll get a repeat test in a couple of days, it comes back positive. But in general, it is as good at detecting the Delta variant as anything else. I, in the emergency department, am not testing for the Delta variant specifically. I'm testing just, do you have COVID-19 or do you not? And then we are sending samples out to, state and federal laboratories where they're doing further analysis of the genomes of these viruses to see, is it Delta, is it Alpha, which variant is it, to get a sense of what's happening across the country and in certain regions.
Okay. Now, what causes a virus to change to a new variant? I mean, that, Dr. Harris, that like trips me out. You know what I mean?
I know.
Like, okay, COVID, we're getting over it. And then they're like,
I know.
There's another variant, and then there's another variant. And then there's like, how does this
I know. So viruses are strange. They're not even really even alive. They're kind of just genetic material. They rely on us. They rely on our bodies to make more copies of themselves. So when they go inside of our cells will replicate the virus, and they replicate that genetic material. And it's pictured writing something out by hand. They're not using a photocopier. It's physically getting written out line by line. And so you can imagine that there's mistakes that can be made with that. So every time a mistake is made, there's a potential for something to happen that makes it stronger. There's also the potential for something to happen that makes it weaker, but those are the ones that will die out. When something that happens that makes it stronger, we know that once it's stronger, that it will then become the one that takes over, because it's going to infect more people. It's going to be more successful. We've probably heard of survival of the fittest. This is the fittest virus, and we see that it's surviving better than the rest of the strains. So it's kind of like that game of telephone. If you've ever played that, you whisper something in somebody's ear, they whisper it in somebody else's ear. The more it has a chance to spread, the more likely it is to change, and the more we see these variants taking place.
Okay. Now, with all of the new variants, would you still recommend people to get the COVID vaccine?
I 100% recommend it. It is the thing that I recommend. It is the thing that we can do to stop not only this variant, but other variants. What happens when people are not vaccinated is that it gives the virus an opportunity to infect more people, and to infect them in ways where there is more virus replicating going on. So if you don't have your vaccination, you become essentially a place where the virus can come and create new variants. It's also, you're a spot where the virus can come and infect, and you can get the Delta variant yourself, which is more infectious for you. So if you have been vaccinated, we know that even the Delta variant, you are still protected if you're vaccinated. You are 3 times less likely to get sick at all and feel any symptoms. You may get sick, you may feel symptoms, but you are far less likely to. You are 10 times less likely to be hospitalized or die from the virus. So overwhelmingly, the people that are getting sick and the people that are getting hospitalized are people who have not been vaccinated. And that is across the country. We are seeing that everywhere. So to protect yourself from this variant, the best thing you can do is to get vaccinated. And then to help prevent the development of any new variants is really to get vaccinated, because it doesn't have the chance to come into your body and use it like a factory to create new variants. If you do get an infection with COVID after you've been vaccinated, it can't take hold. It doesn't replicate as many virus particles. It's just not as effective. You have so many more weapons against the virus once you've been vaccinated. I still have friends and family members who are concerned about the vaccine and who are a little bit leery and don't know if they want it yet. And they have their reasons that I've listened to, that I understand, that I think are valid reasons for them. And what I tell them is that, I don't want you to get sick. I don't want you to die from this, because it's preventable at this point. It's very largely preventable for most people. And so I don't even try to convince them that it's better for the larger good, even though it is. It's just better for them as individuals. And looking forward, if we want to get back to kind of normal life, get our kids back in schools, keep businesses open and thriving. I mean, this is what has to happen, because the other thought about the Delta variant that concerns me is that it may lead to increased rates of reinfection. You may have heard you can get COVID, but then you can get it again. We're thinking it's possible with Delta that you can actually get it again, but you're more likely to get it again. And that creates a situation where you're not getting immunity from it. You're not getting protected once you've been infected.
Right. Yeah. And I too have some friends that are not vaccinated and they are not going to get vaccinated.
Yeah.
And some of them are very relaxed in
Yeah.
what they're doing and where they're going. But it scares me. I have two grandbabies and they are the love of my life. And I don't want to bring them any harm in any way.
Right.
They're 4 and 3.
Yeah.
My granddaughter's going on. She's 2, going on 3, actually 33. But I don't want to do anything to harm my grandbabies in any, as well as my parents and my other family members. Dr. Harris, let's shift the conversation a little bit. You and I know each other from serving victims of crime in Einstein. And as you know, I am not deathbound. I'm right around, and I go to people's homes, and I was going into Einstein Hospital. But when COVID first hit Philadelphia, I stopped because I'm afraid of the virus. And then I gradually started going back to do home visits, but I would ask people, do you have a porch? Do you have a patio? Come on out. I'll wear my mask, wear your mask. Now, with this Delta variant, should I halt home visits again?
I wouldn't say you need to halt them, but what I would say, and what I say to everybody, is you need to know your own risks. So like you said, you have grandbabies to look after. They're too young to get the vaccine. If you have elderly relatives with a lot of risk factors, you do potentially risk bringing that to them. Even though you're vaccinated, there's a small chance you can get an infection that you could spread to others. And currently, at least in the area surrounding Einstein, and some of the victims you serve are from the Einstein community, we have very low vaccination rates. We're under 40% in the community surrounding Einstein, which is very low. We're actually below the national average, which is around 50%, which is also low. So we want to get that up to 70, 80%, which is, we're not there yet. So there's a good chance that you'd be working with folks who don't have their vaccines yet. So that puts you at a slightly increased risk of being exposed. What I would say is the safest thing, like you mentioned, being out on a porch, being outside, and both of you being masked. So there's a lot of debate about masks and if they work or not. And the answer is they do work, but they work best when both of you are wearing masks. So the most effective thing is if somebody's infected, they need to be the ones wearing the mask. That is the most effective thing for them to stop those virus particles from coming out. And then you also need to be wearing your mask, because when both people are masked, that's the most effective. So that's what I would say to minimize any risk. Keep it outside when you can, and both be masked. I don't think you absolutely need to stop those interactions right now, especially if you're vaccinated. That gives you a great degree of protection. And that is really the best thing that you have done, is to get vaccinated for yourself, and to keep your health, keep your health kind of as your top priority.
Now, gun violence in the city of Philadelphia, as you know, has reached an all-time high. It's alarming and heartbreaking. How has Einstein Healthcare Network dealt with the gun violence, and have you seen an increase in shooting victims and domestic violence victims?
So we don't, at least to my knowledge, have not specifically kept track of domestic violence victims. It feels like we're seeing more of them since COVID began. And for sure, we do keep track of our gun violence victims, and for sure we are seeing more. And so even our month by month average is higher than the preceding years. And last year's was higher than the year before, and this year is higher than last year. And we're seeing that very consistent trend, and that's consistent with what's happening throughout the city. And that's consistent with what's happening throughout a lot of major cities in the country. We as an institution, we have been doing things throughout the years. One thing obviously we've done is partnering with you to provide services, not just to victims of violence, but victims of crime. We think that it's very important to get people connected to services that they need, that they're otherwise not going to get, that we can't just treat them, and then put them back in the community with nothing and no resources, because they need kind of wraparound services to get back on their feet. I direct the trauma intervention program, and we just got a grant to hire staff to help coordinate these services, provide outpatient mental health recovery services, so that we can work on their psychological and their physical needs. We coordinate our services with a lot of other organizations throughout the city. And that's really, I think, increasingly what we're seeing we need is this sort of approach of collaboration with groups that are out in the communities to work together to provide the best resources we can for patients. After the shooting at Broad and Olney, which is right, in front of Einstein, there were, I think, 8 people shot in broad daylight. We realized as an institution that we need to help coordinate these resources a little bit better, find out what we're doing, what we need to do more of, and how we can support existing efforts. So we created the Gun Violence Prevention Task Force as an institution to really bring out the best in our efforts and find out what we can do more of. So we've been meeting regularly as part of this task force, and we've had a couple events so far. We supported the Wear Orange Day in honor of gun violence victims and to increase awareness. We've had a lot of advocacy efforts to try to increase funding for gun violence prevention. We've had volunteers out in the community. We have a new video that I'm excited to share with people about gun safety locks and how they work. And we're just going to continue to amplify those efforts moving forward, because we need to provide, I think, even more services as we see this is a parallel epidemic to the one that's going on that we see as, COVID cases have risen, so have these cases of gun violence. And it's not surprising that we've increased this disparities that exist in these communities, and that's what is causing a lot of the gun violence. And so they both need to be addressed.
I agree. And I value the relationship that I have with Einstein Healthcare Network, because it allows me to serve victims in real time. The victims I'm going to touch anyway in the Northwest section of Philadelphia in the 5th, 14th, 35th, and 39th. But when that victim is in Einstein Hospital and one of the advocates from Einstein is able to say, listen, Northwest Victim Services has free services. We can help you with any unpaid medical bills that you may have, any lost wages, with therapy. If the person is apprehended that did this to you, they'll go to court with you. When we have that soft handoff, it makes all the difference in the world, as opposed to them just receiving our mail. And, you're looking at the bill like, something free. Right. So I value that relationship that we have with Einstein. Now, when victims of crime come into Einstein, are they automatically tested for COVID to keep the staff safe?
So not automatically. It's not the first thing that's done. The first focus when somebody comes in, especially if they're critically ill, if they've been shot or stabbed or assaulted, we want to make sure they're physically okay first. So we tend to their most critical physical wounds first. If they get admitted to the hospital, everybody gets a COVID test, and that is to help keep people safe, because you wouldn't want your neighbor being COVID positive without you knowing it. And so we don't force the test on anybody. If somebody refuses, we're not going to, force you to get a test you don't want, but it is a mandatory test pretty much that is important for the safety of not only staff, but the other people around you in the hospital. And so that's an important part of how we're safely caring for patients here.
Okay. I mean, I can imagine that if someone declines a test and they're positive, but they don't know, then that puts the staff at a great risk.
Right. We still operate as if we kind of assume people are positive. We've had cases where a lot of times after a certain trauma, we are getting a CAT scan of your chest, for example, or an X-ray to look for injuries. And we find signs of COVID on the CAT scan that we're not expecting. And somebody will have no symptoms. And we ask them, have you had an illness recently? Have you been coughing? Have you felt short of breath? And they say no. And then we test them and they're positive. So it's one of those diseases that's part of what's tricky about it, is that you can have no symptoms and you can have signs of COVID pneumonia on your X-ray or your CAT scan. And that's part of why we test everybody, because you just don't know. I hear people say sometimes when I offer them the COVID test, if they come into the hospital, even if they have symptoms, they'll say, I don't have COVID. I know I don't have it. I say, there's no way to know if you have it or not. You honestly don't know. And especially if you're having symptoms, you do not know until you get a test. And so it is part of keeping our staff safe. But again, staff, we operate under the assumption that a lot of people could have it, even if they don't have symptoms. And so we keep ourselves safe. We still wear our masks. We are not allowed to take our masks off in clinical areas. So if you come to the hospital, you'll see us wearing masks. We still use PPE. We have all the protective equipment that we need. We have gloves, we have gowns, we're sterilizing the areas frequently. So I feel safe getting care if I need to. If my family needed care, I feel safe having them go to the hospital. It's not something that I feel people need to avoid. I want people to want them to see their primary doctors. I want them to come to the hospital if they're having an emergency. For any reason, I want people to feel comfortable coming into healthcare systems. It's not something I want them to avoid, because we are able to keep sick people away from not sick people, in part because of the testing that we do.
Right. That is very, very smart. Now, do you see this Delta variant shutting down a lot of cities again?
It doesn't sound like we're going to go in that direction. I think in part because a lot of the shutdowns were designed to help healthcare systems not get overwhelmed. And we're at a point where I think that we have these systems in place where we can handle it. And vaccines are so effective at keeping people out of hospitals that even though our vaccination rates are low, we have people that are vaccinated now. And those people are generally not going to end up in the hospitals. They may get a couple of days of illness that are inconvenient, but they're not the ones who are going to be in the hospitals. So we've already taken a big burden off the healthcare system in that way. I don't think that the move is to go to have shutdowns. And, Dr. Fauci just mentioned that he doesn't see that happening either, that's not where we're headed. I'm hoping the most important thing that can happen is that schools remain open for children. I think that schools being closed was a big burden on working families, and that put a big stress. And I think that was actually part of what's been behind some of the gun violence increase that we've seen, is the disorder that put into these families and these homes. And so I'm hoping that children are able to stay in schools. The American Academy of Pediatrics came out with a statement basically requesting that there be mask wearing for children and teachers in all schools so that children can remain in schools, because there are documented detriments to kids when they're not able to go to in-person learning. And so that's the one thing I hope can actually stay open, stay focused for our children, and that will not get shut down as the Delta variant goes forward, because most children are not vaccinated. Only 12 and over are. Not even all of those are vaccinated. So it may be a problem we may see more of even in the fall. And actually, it was the rise in cases in children in Philadelphia that prompted the health commissioner to recommend indoor masking again. There's no mandate, you're not forced to, but there is a recommendation in Philadelphia that if you're going indoors, you wear a mask regardless of your vaccination status, because of this beginning of the rise of cases, largely in children who are largely not vaccinated.
Right. Now, how you hear so many things about the virus and, what's true, what's not true. And I want to go back to what you said a little while ago about the Delta variant. Now, is it airborne? Was COVID-19 airborne?
So there's debate about it. It's a fuzzy definition. And there was a lot of talk among scientists about trying to get it classified as airborne. It's not classically an airborne virus, but for the purposes of just describing it to people, what I would say is that it is something that can live in the air through aerosols that we generate by talking, breathing, laughing, singing, and those are things that we need to understand in terms of our behavior. So the most important thing to understand is, what is a dangerous situation for me to be in? And so that would be one where you're indoors, where these particles that you're breathing out can circulate in the air. And it's not just the sneezing like we talked about. It's not just the coughing. It's not just when somebody is visibly sick. If you picture somebody breathing out, and if you're in close enough proximity to them where they're breathing out in front of you, that is a condition where, they're not masked, you're not masked. You can catch that virus because you're indoors. When you're outdoors, the wind and the temperature can kind of push that away, and it's not as much of an issue for you. If you're just passing somebody on a street, typically not as much of an issue for you. And so that is the thought of being in kind of a cramped quarters with somebody, riding in a car with somebody without good airflow, for example. And the more people you add to the mix, the more likely that one of them will have a COVID infection, and the more likely that, that there's more particles in the air.
Okay. All right. Yeah, that makes sense. And I stay around my circle, my family circle. Yeah. And I will be 50 this year. So I told my family, I told my husband, don't plan nothing big for me. Don't do that. I'm okay with going to my parents' house and listen, give me a rib or give me a buffalo wing and some fries, and I'm happy, because this is really, really scary and really frightening. Yeah. So hopefully we will get through this, and another new variant will not come forth.
I know. I'm hopeful. I'm hopeful that more and more people will accept the vaccine. And I'm not a proponent of forcing the vaccine on people. I never want people to feel like they have to. I want them to get enough information and feel comfortable with it and feel like it's a good choice for them. And I think that the medical community has an obligation to get people to that point. I think that a lot of what we see, for example, in Philadelphia, close to 86% of whites are vaccinated and around 50% of African Americans are vaccinated. And that speaks to some of the healthcare disparities and some of the bad experiences that African Americans have had in the healthcare system. And so we have an obligation within that, I think, to work on our relationships that we have with our patients and within the community. And so I don't blame individuals, but I think we need to educate individuals. And so I think that we're working on that. We have more work to do because I never want people to feel like you have to, it's compulsory. That's kind of a rabbit hole we go down with, why am I being forced to get this vaccine? It scares a lot of people. It's a new thing. A lot of people don't want to get their flu shot, and that's been around for a very long time. And so I want people to be empowered with the information that they need to feel that this is a good choice for them. And if that takes them a little bit longer, it takes them a little bit longer. We don't have all the time in the world because we are generating new variants and it is getting more dangerous for us. And eventually, COVID is going to be with us. That is the reality, that COVID will be around. It'll become part of our background. It's not going to drop off the face of the earth. It will become somewhat like the seasonal flu. Most of us will either have had it or be vaccinated against it. But my goal is for it to become, and the goal of public health professionals and scientists and doctors is for this to become something that isn't deadly for us, that is a nuisance, that is like the seasonal flu, that can be deadly for some groups, but overall is not causing the degree of death and destruction we've seen this do. So I encourage any patient and I see this still, patients that don't want the testing, don't want the vaccine. We offer it in our emergency departments. If you come visit us during the day, we have a vaccine team that is deployed to give people the vaccine while they're physically here for an unrelated issue. We can get you the vaccine while you're in our emergency department. I'm happy to talk to patients about any concerns that they may have about the vaccine, about the safety of the vaccine. People have heard a lot of things. The internet is both a wonderful thing and a horrible thing for what it can spread about a lot of misinformation about what the vaccine can do and the side effects and the long-term side effects. And there aren't really any long-term side effects that we're seeing from this. And so I really am happy to talk to anybody about the vaccine and its safety, and anybody who may be kind of on the fence about it, to help get them to a point of being safe from this next variant.
Yeah, and Dr. Harris, I think that is one major issue. It is the internet, because a lot of people are reading what's on the internet, and a lot of it is misinformation. And some of the stuff I hear, I just shake my head. I don't know all of the answers, but some of the stuff is just like, you really believe it. So,
and they're smart people. When you talk to them, I'm like, you're smart. I can tell you're smart. You can absorb information. It's just that there's a lot of information. And I think people that kind of tend towards the conspiracy theories about the vaccines and everything, I get where it's coming from, because there's a lot of chaos in the world, and there's a lot of chaos right now. And it does give people a sense of control over, this uncontrollable thing, this big scary thing that we have going on. And so I understand where it's coming from. I don't think it's hard to talk to people who really believe in the conspiracy. It's hard to argue with those, but for people that are just scared and want more information, those are people that we can help provide more information to. And I'm happy to talk to anybody who has questions about the vaccine and wants more information and is kind of struggling to make a choice for themselves.
Well, thank you so much, Dr. Harris, for joining me today. It is always a pleasure. I thank you so much for all of the work that you are doing, that your team is doing, and all the staff at Einstein Healthcare Network. Thank you so much for joining me today.
Thank you.
Thank you so much for joining me today. Please continue to stay safe. My prayers are with all of the family members and loved ones who has lost someone during the COVID-19 pandemic. Hope and strength is my wish for you every day. Happy birthday, hubby. We celebrated my husband's birthday, and we had a staycation in Philadelphia just to be safe. We were down on Columbus Boulevard having an awesome time. Happy birthday, hubby. Many, many more. God bless.